Hello, my name is Saadu Abubakar from Nigeria. I am 76 years old. By profession, I'm a teacher in secondary school. It's unfortunate, I had an accident in 2018 where I went to a farm and I had a domestic accident. I fell from a stairs and I broke the femur neck of my right leg. And since then, efforts were made to have a hip replacement surgery. That was not possible from 2018, not until this year, 2022, when I had a sponsor, one of my own schoolmates. He sponsored my trip to Narayana Hospital. That is how I decided to come down to Narayana Hospital. It's interesting. I came with my wife. So when I met Dr. Prashant, he gave me assurance. The first day I met him, he said, "No problem. Your leg will be okay." I said, "Are you sure?" He said, "Yes. It will be okay. Only that your leg has stayed for 4 or 5 years without treatment. And that has caused shortage by 3 inches of one leg. And he's going to be very careful because if he says he's going to draw the leg to be equal to the other leg, it may affect the nerves and that will paralyze me. So I should judge between paralyzed leg and getting one leg shot. I said I prefer to get one leg shot rather than paralysis. That is how we ended up discussing with Dr. Prashant. Because when I was wheeled into the theater, we were discussing, before I knew it, I was sleeping. As if it is 5 minutes. The next few minutes, I was again talking with Dr. Prashant. He said, "Your operation is through." He said, what are you saying? I didn't see anything, I didn't feel anything. He said, "The operation is through." So I was taken into the intensive care unit, ICU. And I didn't quite spend 24 hours in the ICU. I was brought back to my ward. I said, "Why?" "Because I need intensive care." They said, No. "You're okay. You have no problem. You are fine. Your operation is through. And you don't need, not even drugs." I said, "Okay." So I was in the ward for about 1 or 2 days. The next day, I came back to the hotel. It took me only about 2.5 days, and I'm back to the hotel. I was very hearty. I was very well. Before I went to the theater, my wife was crying. But when I came out, she was laughing because I came out well and hearty. And that is the miracle of Narayana Hospital. Dr. Prashant is a thorough professional that I appreciate so much. Another professional that impressed me so much was Dr. Ashutosh, the physiotherapist. The most interesting part of it is that 1 minute to 8 o'clock, I will hear the bell ringing. Who is that? Dr. Ashutosh. And as he enters business, lie down, take your exercise. I'll take all the exercises. I'm very impressed because for consecutive days, Ashutosh will come dead on time. I appreciate and I like his character. And so I thank the professionalism in Dr. Prashant and other doctors. I thank the nurses that are very kind, very humane, and I thank all the staff that we met at Narayana Hospital. Thank you very much.
So I am happy to share one of my patients who is Abu Bakr, who had a fracture neck femur in 2018. Because of the unfortunate events, and then he has approached the local hospital for the treatment, but probably because of the COVID situation, he was not opted in surgical management, and he was managed conservatively, non-operatively, and that he has carried on for the long 4 years. He has suffered this pain for long 4 years, and then his mobility was completely restricted. He had become bedridden, where the person need to be community ambulator, and so because of this, his general condition was getting deteriorated. And in the same concept, just a few weeks back, the management team came and they spoke about this X-ray and his findings. So then we have this just a fracture neck femur, which is routinely managed very efficiently by either a hemi hip replacement or a total hip replacement, which would work wonders in these kind of cases. So we advise that that is a surgery what is required, and they took our advice and they moved to here to get this surgery done. The day I saw this patient, I was very impressed with the way he was presenting himself. And definitely he has a problem in the hip, and he knows what the problem is. He knows his leg is fractured and is shortened by 3 inches, and he had limitations. I told him that surgery would solve, and he happily accepted the surgery. The next day he was admitted, and our anesthesia team worked on very well, so that our surgery it was just half an hour to 45 minutes, went on smoothly without much problem. And when the surgery is done, the amount of blood loss was very less, and the post-operative amount of pain was very less. So we would fasten our post-op rehabs. So patient was wheeled into perioperative care, and then the next day, since all vitals were stable, he was wheeled to ward and room where the physiotherapy was done. Then his pain factor was less, then the amount of pain medication required also less, and the physiotherapy team worked on well with him. So his ambulation happened on the next day, and he could climb the stairs, and we are about to get him discharged on the 3rd day. So the patient was surprised to see that the suffering which he is having for 4 years was getting solved in just 3 days. And post-surgery patient, he is not very confident that it is completely solved. He said that he would stay in a hotel for 1 week, 10 days, and let us see how the recovery happens, and then he would go back. And then in the hotel also, our physiotherapy team, Dr. Ashutosh, went there and spoke to him. He had done the physiotherapy part, and then his ambulation became very well. And after 1 week, he came approaching me, "Sir, everything is good." Then he was confident that everything has gone good, and then he has planned to move back.
Patient Sadhu Abu Bakr, he undergone for the total hip replacement, and after the immediate surgery, he shifted in the peri-op, and immediately we started the post-op rehabilitation. In the first day of the surgery, immediately we started full weight bearing ambulation with the walker support. He was much better, he was minimum pain, and immediately we shifted in that semi-bed ward, and the second day only he started walking with that walker support, and independent with the walker support, he started going for the toilet and all. After the discharge, he was very happy, and I want to wish him healthy and prosperous life.